The new Social Security payment amounts for September 2025 have been revealed, and this change is going to affect every senior, every retiree, and millions of Americans who rely on these checks each month. The official adjustment for this year is a 3.2% increase, which means the average retiree will now receive about $1,960 per month. That's roughly $60 more every single month compared to last year, and when you add that up over the course of a year, it comes out to about $720 more in your pocket. For couples, it's almost $1,500 extra over the year, and for those who receive higher than average benefits, the increase is even larger. This is the reality of 2025. Bigger checks are coming, and they're arriving right now. But let me ask you, how does $60 extra a month feel to you? Does it feel like a meaningful change, or does it feel like just a drop in the bucket compared to how much you're spending on food, housing, healthcare, and daily living? Hold on to that thought, because in this video we're going to explore not just the increase itself but also the hidden details that could either boost or shrink how much money actually stays in your pocket. We're going to look at Medicare premiums, new prescription drug rules, supplemental security income changes, and even the long-term future of Social Security itself. So don't go anywhere, because skipping even one part of this update might mean missing information that directly affects your wallet. Before we dive deeper though, do me a quick favor, hit the like button, subscribe if you haven't already, and turn on notifications. That way YouTube will share this update with more seniors who need to know, and you'll never miss another important announcement about your benefits. And while you're here, leave me a comment down below. What would be the very first thing you'd spend $60 extra on every month? This annual adjustment is called the Cost of Living Adjustment, or COLA. It's designed to make sure that Social Security benefits keep pace with inflation. The government measures inflation through something called the Consumer Price Index for urban wage earners and clerical workers, or CPIW. Based on that number, they calculate how much Social Security checks should rise in the new year. Over the past few years, we've seen some of the biggest increases in history because inflation was surging. In 2022 and 2023, seniors received record boosts, the largest in decades. But in 2024, the increase was much smaller, leaving many people frustrated and feeling like their benefits were falling behind. Now in 2025, the increase is back at 3.2%, which some say is fair, while others argue it still doesn't fully reflect the real cost of living that seniors face every day. Here's the part that makes things complicated. Even though your check is going up, some of that extra money is already being claimed by rising Medicare premiums. Medicare Part B, which covers doctor visits and outpatient services, is increasing from $174.70 per month in 2024 to about $185 in 2025. That's an increase of about $10 every month. So while Social Security gives you $60 more, Medicare takes $10 back, leaving you with about $50 extra in reality. It's like taking one step forward but also half a step back. And yet, even with that subtraction, you are still netting more than last year. But there is more good news that balances this out. Thanks to the Inflation Reduction Act, brand new prescription drug rules are kicking in this year. Insulin costs for seniors on Medicare are capped at $35 a month, and starting in 2025, out-of-pocket drug costs will be capped at $2,000 per year. For many seniors, this is not just helpful, it's life-changing. Think about it: if you were paying $5,000 or even $7,000 annually for prescription drugs, this year you will never pay more than $2,000. That's a savings of thousands of dollars. When you combine that with the COLA increase, suddenly some seniors will actually be ahead in a way they haven't been in decades. This is why it's so important not to just glance at the new amount and stop there, because the full picture includes Medicare and drug costs too. Let's keep this conversation going, because I want you in the loop from start to finish. Say you're receiving the average check of $1,960 a month. With the new COLA, you're up about $60. Medicare takes $10 of that, leaving $50. But if you're diabetic, you're saving at least $40 a month because of the insulin cap. That means your real monthly difference is about $90 better than last year. Over 12 months, that adds up to over $1,000 in your pocket. And if you've struggled with high prescription costs that used to drain your savings, the new $2,000 cap could save you even more. This is why the story of 2025 is bigger than just one number on a Social Security statement. Now, let's address inflation. Government officials say inflation is cooling, which is why the COLA didn't come in higher this year. But do you feel like inflation is cooling in your life? When you buy groceries, are your bills going down, or do you still feel like every trip costs more? When you pay your electric bill, does it feel lighter than last year, or just as heavy? Many seniors say the numbers the government reports don't match the reality they live every day. And that's part of the problem. The CPIW, the formula used to calculate the COLA, tracks expenses for working Americans, not retirees. Seniors often spend more on healthcare and housing, but those aren't reflected as strongly in the formula. Advocacy groups have been pushing for a senior-specific index called the CPIE, which would more accurately measure what older Americans actually spend money on. If that were used, your increase could look very different. Do you think that would be fairer? Share your thoughts in the comments, because this debate could shape the future of how Social Security works. Here's another piece of news. Supplemental Security Income, or SSI, which supports the most vulnerable seniors and disabled Americans, is also rising in 2025 by the same 3.2%. That means individuals will now receive up to $943 a month, and couples will receive up to $1,415. It may not sound like much, but for those living on the lowest incomes, every single dollar matters. And it's important that we include them in this conversation, because Social Security is not just for retirees. It's a safety net for millions of Americans who cannot work due to age or disability, and these increases matter just as much to them. Of course, all of this raises the bigger question: what is the future of Social Security? You've probably seen the headlines warning that by the mid-2030s, the trust fund that supports Social Security could face shortfalls if no action is taken. That doesn't mean the program will disappear. Social Security is far too important for that. But it could mean across-the-board cuts of around 20% if Congress doesn't make changes. Some proposals suggest raising the retirement age, others want to lift the income cap on payroll taxes so high earners contribute more, and still others want to adjust the formula for calculating COLA. None of these options are easy, and every one of them sparks heated political debate. For now, though, what matters most is that in 2025, your benefits are secure and you are getting this increase. That's the news you can count on today. But let's return to the human side of this. Numbers are important, but what matters most is how you feel them in your life. Will $60 extra a month ease your stress? Will it cover your rising grocery bills, or your electric bill, or maybe allow you to buy a little extra for your family? Some seniors say it means the difference between paying a bill and falling behind. Others say it's not nearly enough to keep pace with the real costs of living. Where do you fall? Do you feel supported, or do you feel like you're still being asked to stretch your dollars further and further? Your story matters, and I want to hear it in the comments, because when seniors share their voices, it builds a stronger community and a stronger case for change. So as we wrap up, let's bring it back to the heart of the story. In 2025, Social Security checks are increasing by 3.2%. The average retiree is receiving about $60 more a month, couples are seeing nearly $1,500 more a year, and SSI recipients are also benefiting from the same increase. Medicare premiums are rising by about $10, but prescription drug savings could mean hundreds or even thousands more left in your pocket. Inflation may be cooling on paper, but the real cost of living still feels heavy for many. And while the future of Social Security faces long-term challenges, the present news is clear: your checks are bigger this year, and the changes are already taking effect. If you made it this far into the video, thank you for staying with me, because staying informed is the most powerful tool you have. Do me a favor before you go: hit that like button so YouTube knows this information matters, subscribe to the channel so you never miss an update, and turn on notifications so you're the first to know about changes that affect your benefits. And tell me in the comments, what's the very first thing you're going to do with your extra Social Security money this year? Will it go toward bills, food, healthcare, or maybe something just for yourself? This is your money, your benefits, and your future. And together, by staying informed and sharing knowledge, we can make sure no senior is left in the dark about what's really happening.